Global Health students. I hope you're having a great day. I would like to introduce to you our Module 1 lecture entitled Introduction to Global Health. I hope you've all gotten onto our Canvas site and that you were able to peruse the various modules and the various components. And if you have any questions at all, please go ahead and give me a call. Well, I first wanted to review our readings for Module 1. We have a couple of different articles that I wanted to share with you and have you take a look at. The first article is called Towards a Common Definition of Global Health, which just highlights the difference between international health and global health, and it gives you a better overview of actually what is global health. The second article is one that is a website that highlights the Millennium Development Goals, or the MDGs, and these are goals that we'll be talking about throughout the semester. They are, as you can see, the third article there, United Nations report. The United Nations created the Millennium Development Goals, which expired in 2015, and then they took those goals and expanded upon them for the Sustainable Development Goals. And so these articles share with you some insights about what they are and what they are hoping to achieve. Then the next article is a New England Journal of Medicine article that highlights the Sustainable Development Goal on the shifting to sustainable development. Then I bring you to an article called $1 Million to Change the World. And it's an interesting article about the MacArthur Foundation, and they are willing to fund a dream. For anyone who's willing to, has a great idea that can make a difference in the world, they're willing to fund that. So I'm always trying to inspire my students to make a difference in the world, and this is an organization that will fund your idea. Then I have a video on this competition. And then there's another article by Bill and Melinda Gates. It's actually the Bill and Melinda Gates Foundation website. You should go ahead and take a look at it because I allude to this foundation many times throughout our semester. They're doing wonderful work, and each year they put out an annual letter, and that's the next bullet, the Gates Foundation annual letter for 2017. And actually this should not be indented. It should be its own bullet. They put out a State of the Union, such as for the foundation, where we are right now. They'll put out another article, another letter in 2018, so we'll look forward to reading that. So these are the readings for Module 1. I'd love for you to take a look at those when you get a free moment. And then some concepts that I'd love to review with you in Module 1. What is health, public health, and global public health? What are the differences? Why do we need these measures for health? Why is it important to measure health? What is the global burden of disease and why do we need it? What are the global health priorities in the world? And what are the social determinants of health and how do they impact health and health well-being? What is this terminology of a health transition? What does it mean and where we are in the spectrum of this transition? And then I'll go through the Millennium Development Goals followed by the Sustainable Development Goals. So first of all, let's take a look at health. I've shared with you the definition of health, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is from the World Health Organization, or WHO. Please don't ever call WHO WHO. It's the World Health Organization, or WHO. And this is their general definition that we all follow to define health. And what do you think this is? Take a look. You can pause the video and read it along, or I'll read it to you. The science and art of preventing disease, prolonging life, and promoting physical health and mental health and efficiency through organized community efforts toward a sanitary environment, the control of community infections, the education of the individual in principles of personal hygiene, the organization of medical and nursing service for the early diagnosis and treatment of disease, and the development of the social machinery to ensure to every individual in the community a standard of living adequate for the maintenance of health. What do you think that is? That is public health. And then we'll look at another definition. What is this? An area for study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. It emphasizes transnational health issues, determinants, and solutions, involves many disciplines within and beyond the health sciences, and promotes interdisciplinary collaboration, which is, I feel, incredibly important, and is a synthesis of population-based prevention with individual-level clinical care. What do you think this is? From your readings, what do you think this is? This is global health. Now I'd like to share with you a YouTube video about the story of Ali, a child named Ali.
Ali Bala lives in Niger, West Africa, one of the poorest countries in the world. His son, Mustafa, is 9 years old. When it's hot, he loves to swim in the local lake, but it's swarming with parasites. Ali knows how vulnerable his son is. People in Niger have to battle against a number of diseases, common diseases that persist in the poorest communities, but have been eliminated and forgotten in wealthier places.
Il y a les maladies, il y a la mort, la sous-alimentation, surtout en campagne. Les populations souffrent beaucoup.
But there is a ray of hope. Dr. Mariama Lamine, an expert on parasitic disease, is laying the foundations for a national plan to tackle these neglected diseases across Niger.
Un rêve grandiose. Il demande beaucoup de moyens, beaucoup de vivacité, de dynamisme. Ce que je veux, c'est au moins avoir, surtout dans les zones rurales, là. Dans les zones rurales, parce que c'est les zones les plus frappées par beaucoup de maladies. C'est les zones les plus vulnérables par certaines maladies. Donc, ce que je veux, ce que j'espère avoir dans l'avenir pour le Niger et surtout pour la population rurale, au moins qu'il y ait le minimum pour leur santé. Bonjour les enfants. Ça va bien? Ok.
Dr. Lamine is testing Mustafa's class for the parasites which cause the disease schistosomiasis. 1 in 5 is infected and will develop this debilitating and life-threatening disease. The results of the tests are critical in rolling out an ambitious national treatment program. A huge quantity of medicines has been donated, 5 different drugs to tackle schistosomiasis and 4 other neglected tropical diseases. It all seems so easy, which begs the question, why has this not been done before? There are simply not enough health professionals to hand out the drugs, but there is another solution.
Ce que nous espérons, c'est que toutes les personnes qui souffrent de ces maladies puissent être traitées. Et c'est pour cela que dans la stratégie que nous avons mise en œuvre, nous allons former des distributeurs communautaires dans chaque village.
Ali has been chosen to distribute drugs in his village. He's not a doctor, he's just a farmer. He's one of 17,000 community distributors entrusted to wipe out 5 common diseases from Niger. Like lymphatic filariasis, or LF, which has plagued Halima since she was a child, causing her leg to swell.
Kuma in wani abu ya yage ni sai ruwa sai ta yi ta yaɗi kawai ruwa kamar ta yaɗi kin gane sai ki ta zo ba sai su yi ta yaɗi a da ma kin taɓa jin likita mai kula da irin wannan ciwo muna yi amma ba su kawo gare mu sai bana sai bana inda kaje inda za a samu lahiya ai baka tsayawa na tsayawa to.
The drugs used to treat LF won't reverse the damage to Halima's leg, but they can prevent the disease spreading. If Ali and the other community distributors can get the drugs to everyone, LF can be eradicated within 5 years. And the blinding eye disease trachoma. Many people in Ali's village, including Hadiza, complained of the symptoms.
Da kai da zahi kuma da kai da zahi sai ka ce wuta ana watsa mana wuta.
Trachoma is a bacterial infection spread by flies, towels, or direct contact. A single dose of the drug Zithromax can kill the bacteria, but cannot prevent reinfection. Efforts also need to be directed at educating people on hygiene and improving sanitation. But the road to elimination of all these diseases starts with getting the drugs to the people. Ali is trained to distribute albendazole and Mectizan to his whole community. A week later, Ali distributes praziquantel for schistosomiasis. And finally, Zithromax for trachoma. If everything goes to plan, 5 neglected diseases could be wiped out in the next 5 years.
Suite à cette distribution de médicaments, nous aurons moins de problèmes, car nos enfants seront vaccinés, seront traités. Parce qu'à cela, je me sens bien. Et je pensais que tout ira bien.
So, what did you think about the story of Ali, of the neglected tropical diseases in Niger, West Africa? What did you see? What did you hear? And what did you feel? What do you think are some key messages from this video? What did you take from it? What inspirations can you take to move forward with the class? I thought it was a good video to start the semester with. Now, moving on to measures of health. Why do we measure health? Why is it important to measure health? What are some reasons to measure? To calculate the burden of disease, the frequency of something, the incidence and the prevalence, the severity, looking at mortality and morbidity rates, and consequences in terms of health, social, and economic areas, and the population affected, looking at gender, age, and socioeconomic status. Throughout this course, we'll be looking at countries according to the World Bank country classification. And as you can see, this map is color-coded according to the groups. Orange indicates countries that are of high income. Blue are high income but non-OECD. Purple are upper middle income countries. The red color is a lower middle income country, and green is a low income country. And we'll be particularly focusing on the green, red, and some of the purple countries throughout this course. And then we focus on our burden of disease. What are the top 10 causes of death in a low income country? So what are they dying from? And you can compare these with the next 3 slides, how different the causes of death are. So if we're looking at low-income countries, top reasons why can be contributed to lower respiratory infections, HIV/AIDS, diarrheal disease, things that we have medicines to treat. Look at diarrheal disease, clean water. Then if we compare it with high-income countries, what is the top cause of death? Ischemic heart disease, stroke. I mean, those are 2 from more developed countries. Unfortunately, now many developing countries are now being faced with these non-communicable diseases like heart disease, diabetes, and stroke. But if you compare it with low income versus high income, and let's compare the 2. How are they different? Looking at how people die and why, it's an important area to focus for addressing the effectiveness of a country's healthcare system. And now looking globally across all countries, what are our top 10 global health priorities? Number 1, focusing on maternal and child health. Why are women still dying in labor? Why are children still dying? Why are so many children dying under the age of 5 when we have so many advancements all over the world? HIV/AIDS, nutrition-related challenges. We'll focus on that throughout this semester. Over and undernutrition and the double burden of disease focusing on nutrition. Tuberculosis, malaria, cardiovascular disease, tobacco use. And tobacco use, which is now less prevalent in more developed countries, and now it's growing more and more in developing countries. Tobacco companies are very smart and clever, and they want to focus where they can sell the most product in the developing country where there aren't as many regulations against tobacco use. And then we look at the health transition into the 20th century, looking at global health 100 years ago. What was the world like? We had high birth rates. Women were having so many children because their children were dying or their women were dying. There was a high death rate and a very short life expectancy, and a high burden from infections and from undernutrition. Children were starving to death. People were dying from diarrhea infections that can be controlled today. And high-income countries today, like the United States, we have a lower birth rate and a lower death rate. People are living longer, and we're faced with challenges from chronic diseases and overnutrition, from non-communicable diseases. Obesity is huge. It's a big problem, and it's growing all over the world. I wanted to share with you the health transition model, looking at demographic, epidemiologic, and nutrition. So if you look at low income, we're going to look at this chart here with demographic, epidemiologic, and nutrition transitions from low income countries on the top and the left, moving to the middle, which is the middle income areas, to a higher income area. Sorry, I'm just fixing the slide. Examples of low income areas might be Yemen, which has been in the news so much with the cholera crisis, and Rwanda. Middle income countries include China, India, Brazil, and oh my goodness, high income countries include the United States, Canada, and Europe. So if we look at the low income areas, they have a high fertility rate, a high child mortality rate, a generally high mortality rate, and children comprise a large proportion of the population. In places like Yemen, the fertility rate is very high. Women are having many children. Are having 8 or 9 children because the children are dying. They're not living their full life. And they don't use as much birth control. So The children are comprising a larger share of the population. When you look at the epidemiologic transition, there's a high burden, a high death rate from diseases of poverty, like infectious diseases, like diarrhea. And looking at the nutrition transition, many of these young children are underweight, which is a big issue. They're starving. They don't have enough food. They don't have enough meat. And then looking at middle-income countries, they have an intermediate fertility rate, a low child mortality rate, and intermediate life expectancy. They're facing a dual burden from both infectious diseases and chronic diseases. And when we look at the nutrition, there are concerns about underweight and obesity. They've got the two different ends of the spectrum, focusing on challenges from both ends of the spectrum. And high income areas like the United States, Canada, and Europe, we have low fertility rates. In fact, they're so low in some countries in Europe that they're below replacement level. So there are more and more older people and less young people. And we'll discuss this concept of a population pyramid in the next few slides. There's a low child mortality rate, a low death rate. People are living to be very old. Most people are affected with chronic diseases. And according to the nutrition transition, many people are overweight. Our obesity rates are a huge concern in this country. And if we look at the health transition in the 20th century, we look at the major causes of death in the United States in 1900 versus 1950. So we looked at the health transitions for the 20th century, and now we're going to go back two slides. One slide, sorry, looking at this demographic, the epi, and the nutritional transitions in a little bit more depth. So let's look at the demographic transition. So what is this? This is a shift towards lower birth and death rates, which occurs as population become more developed, as they move up the shift from a low income to a middle income to a high income country. And these are the 5 stages, look as the country develops. Mortality rates are in the blue line, go down, and fertility rates also go down, and the total population tend to increase as people live longer in a healthier manner. And this is just another version of that same graph we just looked at, but highlighting the pre-transition, early transition, late transition, and post-transition, looking at fertility rates. As a country improves economically, the health improves. There's that term health before wealth. So once a population becomes healthier, they can be more effective becoming wealthier, working harder. As a country develops, their TFR, their total fertility rates, tend to decrease. So if we look at this chart here, we have high total fertility rates, medium, and low total fertility rates. And the high total fertility rates are those low-income countries like Yemen, like Afghanistan, like Niger. So the Niger's total fertility rate is 7.03 children born per female. Then if you look at countries under a medium total fertility rate, they have less children. Like in India, they tend to have 2.55 children per female. And a low total fertility rate like the United States, like Japan, like Iran. In Japan, as I alluded to earlier, they have such a low total fertility rate, each woman only has 1.39 children. And replacement level is 2.1. So to hold a country at a standard fertility rate, it's 2.1 children per child. Japan is below that. Iran is below that. Germany is below that. And that's one reason why Germany was embracing the refugees, because they needed someone to help do the work, because they don't have any young people to do the work anymore. Their population is getting so much older. So they initially embraced the refugees who were coming into Germany. Now there have been other challenges, so they're not as happy, but that's why they initially embraced them. Let's look at some population pyramids. So these are population pyramids that highlight the composition of a society. These are all high total fertility rate countries. These are 3 examples: Mali, Somalia, and Angola. And from there, from a website on the bottom of the page called populationpyramid.net. This is a great resource if you'd ever, if you would like to look up these populations for a particular country. As you can see, the pyramids for high fertility countries are more of a triangle, and like this, with a large number of children being born and people dying very early. There are not a lot of elders around. They die from infectious diseases or things that can be controlled and wiped out in more developed countries. So this is a high total fertility rate pyramid. And then we can move on to look at another example,